Pharmacology is a crucial field in medicine that involves the study of how drugs interact with the body. One essential aspect of pharmacology is understanding drug-protein interactions, particularly the binding of drugs to proteins. This interaction is significant in drug distribution, elimination, efficacy, and toxicity. In this script, we will delve into the fundamentals of drug-protein interactions, the implications of protein binding in drug distribution and elimination, the influence of bound and unbound drug fractions on efficacy and toxicity, drug-drug interactions, quantitative measures of drug-protein interactions, major plasma proteins involved in drug binding, factors affecting protein binding and tissue distribution, protein binding and clearance mechanisms, clinical relevance of protein binding, techniques for studying drug-protein binding, the importance of protein binding and hepatic metabolism of highly protein-bound drugs, and conclude with a recap of the key concepts discussed. The interaction between drugs and proteins is vital to understand their behavior within the body. Drugs can bind to various plasma proteins, such as albumin, alpha-1 acid glycoprotein, and lipoproteins. This binding can alter the pharmacokinetic and pharmacodynamic properties of the drug, influencing its effectiveness and safety. Protein binding plays a crucial role in drug distribution and elimination. When a drug binds to a protein, it becomes less free and may accumulate in plasma. This protein-bound fraction influences the drug's distribution to tissues and organs and affects its elimination from the body. The equilibrium between bound and unbound drug fractions determines the drug's efficacy and toxicity. Only the unbound, free, form of a drug can exert its pharmacological effects, while the bound fraction remains inactive. Changes in protein binding can alter the ratio of bound to unbound drug, impacting the drug's therapeutic response and potential toxicity. Drug-protein interactions can also be affected by the presence of other drugs. When two or more drugs compete for binding to the same protein, drug-drug interactions may occur. These interactions can lead to altered drug concentrations, efficacy, and potential adverse effects. Quantitative measures are used to assess the strength of drug-protein interactions. Parameters like binding affinity, dissociation constants, and binding capacity allow us to determine the extent and characteristics of drug-protein binding. These measurements aid in predicting the pharmacokinetics and pharmacodynamics of drugs. Several plasma proteins participate in drug-protein binding. Albumin, the most abundant plasma protein, can bind a wide range of drugs. Alpha-1 acid glycoprotein and lipoproteins also contribute significantly to drug binding. Understanding the specific proteins involved in drug binding allows for better prediction of drug behavior in the body. Numerous factors influence protein binding, including pH, temperature, drug concentration, and genetic variations. Changes in these factors can alter the extent of drug-protein binding and significantly impact drug efficacy, distribution, and elimination. Drug-protein interactions affect drug distribution to various tissues and organs. Protein-bound drugs have limited access to tissues compared to the unbound fraction. Understanding tissue-specific protein binding patterns helps in predicting drug concentration gradients and optimizing drug delivery. Protein binding influences drug clearance mechanisms, such as renal and hepatic clearance. Bound drugs may be less available for renal excretion or hepatic metabolism, leading to prolonged drug effects. Therefore, protein binding plays a crucial role in determining drug half-life and overall clearance rates. Understanding drug-protein interactions has significant clinical relevance. It aids in drug development, dosing regimens, drug-drug interaction predictions, and optimizing therapeutic outcomes. Knowledge of protein binding also helps customize drug therapies based on individual patient characteristics. Various techniques are available to study drug-protein binding. These include equilibrium dialysis, ultrafiltration, gel electrophoresis, and spectroscopic methods like fluorescence and nuclear magnetic resonance. These techniques provide valuable insights into the characteristics and mechanisms of drug-protein interactions. Highly protein-bound drugs may undergo hepatic metabolism and biotransformation. Protein binding influences the rate and extent of hepatic metabolism, ultimately affecting drug clearance and potential drug-drug interactions. Understanding the interplay between protein binding and hepatic metabolism is crucial in clinical practice. In conclusion, drug-protein interactions have profound implications for drug distribution, elimination, efficacy, and toxicity. Protein binding affects various pharmacological aspects of drugs and is influenced by factors like drug concentration, pH, temperature, and genetic variations. Understanding the significance of protein binding aids in predicting drug behavior, optimizing therapeutic outcomes, and managing drug-drug interactions. Through various quantitative measures and techniques, we can study drug-protein interactions in depth, allowing for better drug development and individualized patient care.